is Siobhan, and I lead ostomy education here at Better Health. I have an ostomy myself that I've had for 6 years, so I'm well acquainted with all the ins and outs and ups and downs of life with an ostomy. One of the things that I do here at Better Health is coach other people who are having ostomy surgery soon or who've had ostomies recently, and I want to help them thrive with their ostomy. So Sherry, you're having ostomy surgery soon. Tell me more.
I am, and I'm lucky, I think, to have a support network who's sort of rallying around friends and relatives. But I'm not really clear on what they can do to help.
Sherry, there are some really great ways that they can help you. So, one of the ways that your support network can help is just by pitching in with some things like food, bringing you dishes that are easy to heat up. They can pitch in by maybe accomplishing some small household tasks like going to the grocery store or throwing a load of laundry in and moving it to the sheet, moving it from the washer to the dryer. And then, if you're feeling up for it, it's always great to be able to share your experiences with people. That depends on your level of comfort, but I think that it's really positive when people who have had ostomy surgery are able to share their experiences, because we all know somebody whose sister's brother's cousin had ostomy surgery. And the more we normalize it, the more comfortable we'll feel in our own skin.
That makes sense. My sister's actually going to come and stay at my place right after the surgery for a while. But what should I tell her to expect? Right now, I don't have information about her role, and so her anxiety is almost higher than mine.
I'm so glad you have a caregiver coming to help you out. That will make your life so much easier. One of the things that you can let your caregiver know is exactly what an ostomy is. Communicate with them around, well, there's going to be a stoma, there's going to be these products that I need to use. When I get home from the hospital, I'll have a home health care nurse come in and take a look at my stoma and my incisions every few days for a little bit. And you'll learn together. Sometimes a caregiver needs a period of adjustment on their own. They might be a little weirded out by this whole process. That's normal. Well, most people, I find, do a great job of adjusting and just rolling with learning how to manage an ostomy. Now, some of the specific things that your caregiver can do is to help you manage your meals and meal planning. You want to eat a specific diet after your ostomy surgery that is low residue, low fiber, because that diet won't make your digestive system work too hard while it's trying to heal. Another thing that your caregiver should expect is that it can take anywhere from 4 to 6 weeks to even up to 6 months for somebody to really recover and get back on their feet. But again, that can be up to you and her to negotiate on how long she stays to help you. And then finally, and I think this is the most important point with caregivers, let them know to expect some mess. Unfortunately, in the beginning of ostomy surgery, you're going to have some problems with leaks. You're probably going to be changing your barrier more often, and your stoma is going to be doing a higher amount of output because your body's adjusting to having an ostomy. So messes happen, be prepared, put on a pad on the bed to catch that mess if you have a leak in the middle of the night, and just roll with it. You can laugh about it later. It is kind of funny when you have when you're constantly cleaning up poop.
My sister is cool about messes and things like that. I think she wants to actually help me with the basics, like changing the pouch and so forth. Now, but she doesn't know how. Is that something we can learn together from the home health aide, or is it okay to let her help me with that?
Absolutely. You should do what you need. The home health nurse should be able to educate you on your ostomy supplies and make recommendations about what products you need. I recommend that you, to the extent that you can, take care of your ostomy changes yourself, because you're not always going to have somebody there unless you are bedridden or need more intensive care. But if somebody wants to help, if they want to be involved, I'm all for it, especially if there's a situation where you need to go back into the hospital because of a post-surgical complication, or heaven forbid you have more surgery in the future. That person will be there to help you manage your ostomy, and you can feel comfortable knowing that your output is managed and you're keeping yourself clean.
Got it. So she can do it with me. We can learn it together, but I shouldn't get overly dependent on the help, right?
Exactly. That's precisely the best way to put it.
Got it.
Well, Sherry, thank you for joining me here today. For more information on all things ostomy, stay tuned to this video series where we tackle all the topics: diet and nutrition, exercise, activities, relationships, travel, going back to work. It just goes on and on and on.